One of those ascending tracks coming off of the spinal cord. See, it runs right along here on either side. And about right in here is where cranial nerve 11 comes off. This would be the spinal accessory or accessory. Right here along the midline, even though I don't see it on here, is where the hypoglossal comes off. It's a series of fibers running horizontally. And so what I'm basically telling you is we stopped here with 6. The next cranial nerve would be 7. 7's going to be medial to 8, and they come off right next to each other. 9 is going to come off medial to 10. They come off right next to each other. And then you got 11 coming off about right there. So what's here? Well, that's probably part of 7 and 8 here. 7's going to be a little bit more medial, 8's going to be a little bit lateral, 9's going to be about right there, 10's going to be right there. And I don't see any of those things, but I know that's where they come off. And that's what a surgeon needs to know. For good reason. They're going to be doing exploratory surgery on you, and it's not good when the surgeon goes, oh my God, this doesn't look anything like the book, and that happens sometimes. So that's why they don't usually say anything. What system is going to vary the most? Circulatory, because you got cysts, you got tumors, all these things that drain a blood supply of their own. And so you can learn all the book learning that you want to, but when you actually open somebody up and look in there and it's like, wow, that impresses even the surgeons. Not in a positive way, because you know you got to do something with those cysts or tumors or whatever, but it's because it's not going to look like the book. And that's exciting for the surgeon, not for you. There's something wrong with you. But you could study everything you wanted all the years, and then it's like, that one's probably going to vary the most because these things draw their own blood supply. Okay. So 7 and 8, 9 and 10, I'm not going to put on the test. Probably not going to put 11, might put 12, because I think on one of the models that 12 is actually in the lucite, the sheep brain and lucite. I think you can actually see 12 pretty well. So it's probably going to be 1 through 6. So if you get the cheapest brains, that typically if high schools were going to do this, and some of them do, did y'all ever see the movie